Sleep paralysis, understanding, healing, and integrative support. A mind-body nervous system perspective. 1. Introduction. Why this topic matters. Sleep paralysis is one of the most frightening but misunderstood sleep experiences. Many people think it is a spiritual attack, a stroke, or a serious brain problem. In reality, it is usually a temporary nervous system timing issue. When people understand what is happening, fear reduces, and when fear reduces, the condition often improves. 2. What is sleep paralysis? Sleep paralysis is a condition in which a person becomes conscious but cannot move or speak for a few seconds to a few minutes while falling asleep or waking up. It may be accompanied by chest pressure, sense of presence, hallucinations, visual, auditory, tactile, intense fear or panic. Key reassurance. Sleep paralysis is usually harmless and temporary. 3. The brain science. What is REM sleep? REM sleep, rapid eye movement sleep, is the stage of sleep when the brain is very active and most dreaming happens. During REM, the body is naturally put into a relaxed, almost paralyzed state so that we do not physically act out our dreams. This is normal and healthy. REM sleep helps with emotional processing, memory, and mental recovery. In sleep paralysis, a person becomes aware before the body has fully come out of this REM body paralysis, which is why they may feel awake but unable to move. In short, during REM sleep, the brain is active, dreaming. The body is paralyzed, REM atonia. This prevents us from acting out dreams. In sleep paralysis, the brain wakes up, but the body is still in REM paralysis. So the problem is, brain and body are out of sync. This is not a stroke, a heart problem, a seizure, a spiritual attack. It is a timing mismatch. 4. Main causes and triggers. Biological and sleep factors. Irregular sleep schedule. Sleep deprivation. Shift work. Jet lag. Sleeping on the back. Nervous system and psychological. Chronic stress. Anxiety, PTSD, hypervigilance, emotional overload, medical, narcolepsy, certain medications, substance use, integrative view, overactive sympathetic nervous system, poor parasympathetic recovery, autonomic imbalance. 5. The fear paralysis loop. Fear plays a major role. First episode, intense fear. Fear conditions the brain. Brain becomes hyper-alert at night. More REM disruption. More episodes. So part of healing is breaking the fear conditioning cycle. 6. Core medical management, foundation. These are the most important. Fixed sleep time daily, adequate sleep duration, side sleeping, avoid back, treat sleep apnea if present, reduce caffeine and alcohol, reduce late-night screens, stress reduction. Energy medicine should be adjunctive, not a replacement. 7. Integrative and energy medicine support. How supportive devices may help, indirectly. These tools do not treat sleep paralysis directly, but they may improve the underlying nervous system instability. A. Wooger strap, vibroacoustic stimulation. Possible benefits: deep relaxation, body-based calming, parasympathetic activation, reduced hyperarousal, improved sleep onset, increased body safety signals. How it may help. Sleep paralysis. Calms fight-flight. Stabilizes sleep transitions. May reduce stress-triggered REM intrusion. Honest framing. Supportive nervous system regulation tool, not a cure. B. Bone conduction headphones. Possible benefits. Soothing sound without ear canal blockage. Binaural or calming audio. Brainwave entrainment, mild effect. Reduced anxiety. Sleep preparation. How they may help. Improve relaxation before sleep. Reduce mental hyperactivity. Support sleep onset rituals. C. Sound oasis, white noise sound therapy. Possible benefits. White noise or nature sounds. Masks environmental noise. Creates consistent auditory safety field. Reduces microarousals. How it may help. Improves sleep continuity, reduces sudden awakenings from REM, creates predictable sensory environment. D. Vagus nerve stimulation, VNS, non-invasive. Examples: slow breathing, humming, chanting, prayer, cold face splash, meditation, auricular vagal devices. Benefits: improves vagal tone, reduces cortisol, improves HRV, calms emotional brain, improves parasympathetic dominance. How it may help. Stabilizes sleep-wake boundary, reduces REM-wake intrusion, improves nervous system safety. This is one of the most powerful integrative tools. E. PEMF, Pulsed Electromagnetic Field Therapy. Possible benefits: relaxation, pain reduction, autonomic modulation, stress reduction, improved sleep in some users. How it may help. May support autonomic balance, may reduce bodily stress load, may improve sleep quality indirectly. Important: evidence for sleep paralysis is indirect, should be used conservatively, not a primary treatment. 8. Heart, brain, vagus, sleep model. Sleep paralysis reflects brain awake, body paralyzed, heart rhythm unstable, vagus underactive. So healing focuses on heart-brain coherence, vagal tone, parasympathetic dominance, rhythmic safety signals. Devices plus practices may improve system coherence, smoother sleep transitions. 9. Practical integrative protocol. Example: evening routine, 20 minutes. 1. Dim lights. 2. 5 minutes slow breathing. 3. 2 minutes humming or prayer. 4. Optional Wooger vibro-acoustic calming. 5. Sound oasis background. 6. Bone conduction calming audio. 7. Gratitude compassion meditation. Goal: shift from survival mode, safety mode. 10. During an episode, what to teach. Stay calm. Tell yourself, this is temporary. Try to move a finger or toe. Focus on slow breathing. Let fear pass. This retrains the brain. 11. When medical evaluation is essential. Refer if very frequent episodes, severe daytime sleepiness, sudden muscle weakness with emotions, sleep attacks. Suspect: narcolepsy, or other sleep disorders. Closing, empowering message. Sleep paralysis is not a sign of weakness, possession, or damage. It is a nervous system timing issue that can improve with understanding, rhythm, safety, and balance. Energy medicine tools may support the nervous system, but the foundation remains healthy sleep biology and emotional regulation. Integrative tools may support nervous system balance and improve sleep quality, which may reduce triggers for sleep paralysis in some individuals. They are supportive therapies, not primary medical treatment. Disclaimer: educational content only, not a substitute for medical diagnosis or treatment. Thank you. Founder, Holistic Wellness Foundation. Imphal, Healing Beyond Boundaries.